Good morning. My name is Van Laskowski. I'm the Public Information Officer at Stevens County Hospital, coming to you on March 23rd, 2020 with our daily update regarding COVID-19 at Stevens County Hospital. I want to start by saying that the data, the statistics that we're discussing today and over the past week have only pertained to cases that we have seen here in Stevens County Hospital. We're not giving regional data, we're not giving statewide data, and if you want to see that information, please go to the Department of Public Health website, dph.georgia.gov. They give updates daily at noon and 7 p.m. For the purposes of our reports, we are solely reporting what we've seen in our facilities. To date, we have tested 11 patients for COVID-19. We have no positive results, 4 negative results, and 7 results that are still pending. Right now, the turnaround time has been 6+ days for some results. The testing entities, both the state and LabCorp, are inundated with the amount of tests coming in. So it's been, we know it's created some anxiety waiting so long to get test results back, and we do apologize for that. But we are doing everything we can to get results back as quickly as possible. We appreciate your understanding, and we understand and sympathize with any of those who have had to anxiously wait on results. We had some questions come in over the weekend regarding the screening criteria for COVID-19, who gets a test, and I'll go over that briefly. The first part of the criteria is a patient who presents with fever and respiratory illness, a cough, shortness of breath. The other criteria is someone who may have come into contact with someone who is confirmed to have COVID-19 or is suspected of having COVID-19 and is quarantined while they're awaiting test results. We still are actively testing, and we have testing capability at this time. But with limited supply, we do have a criteria for who we are testing, and I'll go over that in a little more detail. There is no age cutoff for who gets a test and who doesn't. There's no minimum age or something like that. So I want to be clear about that. But age is certainly a risk factor that we consider when assessing whether or not to test an individual, because we want to test those individuals who are at greatest risk from the virus. So age is one of those factors. The other factor is the individual's comorbidities, their other health conditions, and how that might play into our treatment for that patient and our management of COVID-19 should they have it. So that's just a brief overview of our screening criteria, and we really appreciate you understanding that we do have limited test supplies at this time. We're working around the clock to secure more testing supplies, more protective gear for our staff and for our patients. We've been extremely fortunate to have some donors step up and give us some supplies. We really appreciate the support that we've been shown to this point, both in terms of supplies and financial donations. McDonald's this morning brought coffee for our staff. We really appreciate that. Cracker Barrel brought us breakfast. So those little things that really keep us going. This is a very challenging time for healthcare personnel everywhere. We've never seen anything like this, and certainly in the modern era in terms of healthcare and the way a virus has impacted society. So we do appreciate your support through this time. We will do our best to answer any questions or concerns that you have about what we're seeing here in our hospital, and we'll continue to give you these daily updates. One more facility update: beginning tomorrow, March 24th, all entrance to the hospital will be through the emergency department. We want to make sure that we're putting our resources where we can best utilize them and ensure that everyone entering the hospital is safe to do so. We're also restricting the number of visitors Certain departments will still be allowed one support person per patient. Those departments are our OB, our labor and delivery department, and for those patients who may need to have family discussions regarding end-of-life and palliative care. Other than that, we are restricting visitors to the hospital. So please understand that our reason in doing that is just to ensure the safety of our patients that are here, our staff, and your safety as well. We really appreciate your understanding while we navigate these uncharted waters. We will do everything we can to continue to support the community as we make it through this crisis. Thank you very much.